we're going to talk about how to measure physician quality. Healthcare is faced with the challenge of balancing cost, quality, and value. And one of the important issues with this is how do we measure healthcare quality, particularly the quality of an individual physician. This is important to physicians because physician revenue is based on not only quantity, but the quality of the health care they deliver. And many compensation models now include a quality bonus for meeting specific quality measures. Medicare value-based purchasing, particularly for hospitals, plays an important role in how healthcare quality is measured. Medicare divides the value-based purchasing program for hospitals into 3 domains, which include patient experience, healthcare outcomes, and the process of care. The process of care are quality measures directed to your practice. Outcomes are outcomes related to your practice, such as readmission rates, mortality, and other measures. The patient experience is really the physician HCAHPS scores and scores related to other aspects of the hospital environment, such as the nursing staff, food service, and the environment within the hospital. The first year value-based purchasing was implemented. About 53% of hospitals received a penalty for not providing sufficient value. About 45% of hospitals started to receive small bonus payments, and about 2% of hospitals had no change in their reimbursement under value-based purchasing. Obviously, if you're in the category of a hospital where there is a financial penalty being applied to you, you want to change this and make sure you're either in the no change or preferably the bonus payment category to help maintain the financial stability of your institution. The way physicians impact this are with the HCAHPS scores. The HCAHPS is a survey sent to patients after hospital discharge. It's 27 multiple choice questions about the experience. Of those 27, 3 questions are related to physicians. First question is during your hospital stay, how often did doctors treat you with courtesy and respect? Never, sometimes, usually, or always. Also, during your hospital stay, how often did doctors listen carefully to you? And during your hospital stay, how often did doctors explain things in a way you could understand? It's important to note that it says doctors, not just you. The results of the HCAHPS questionnaire are usually assigned to the discharging physician. It's entirely possible that 10 or 20 physicians saw the patient during the course of their hospitalization, and they may have influenced the answer to this question. It's also important to know that the Medicare value-based purchasing program only gives credit for the answer of always, and because of that, that's the level of performance usually expected to qualify for bonuses. Always is a difficult benchmark to meet. Ratings will reflect other physician interactions, including that of consultants, cross-cover physicians, emergency department physicians, and other healthcare workers. For clinic-based doctors, there's something called the CAHPS score. CAHPS score is a survey sent to clinic patients. It's either in the form of a visit survey or an annual survey of 34 questions. It's an important quality measure for people who are trying to be certified as a patient-centered medical home, and it is also used by the National Quality Forum as an indicator of outpatient quality. The first question is, in the last 12 months, when you phoned this provider's office for care you needed right away, how often did you get an appointment as soon as you needed? Again, credit is only given for the always choice. They also ask, did you get the routine appointments as soon as you needed? Were your telephone questions answered on the same day? And were in-clinic wait times less than 15 minutes? There is also a domain called physician interaction, where they ask, did your provider explain things in a way you could understand, listen carefully to you, give you information about your health questions, know your medical history, show respect for you, and spend enough time with you? It's important to remember that always is a difficult benchmark to meet, and it's important that you look at the entire patient care process and all of the individuals that interact with patients. You want them to be positive, so hopefully you will meet the always benchmark in as many times as possible. This is an important quality measure for ambulatory services, and working with your practice to try to reduce wait times and improve efficiency can have a dramatic impact on these scores. So why is this important? It's because of the quality bonuses that physicians get for their pay, usually tied to scores like this and meeting a certain benchmark. Also, changes related to revenue generation after the MACRA Act, adding quality to the equation of physician productivity, that these factors are now becoming very important, particularly for physicians that are using the alternative payment model or the incentivized payment system. The merit-based incentive payment system, again, is a bonus and penalty system, focusing on quality, which scores such as the HCAHPS, resource use, advancing care, and clinical practice improvement. And people using the alternative payment model, the patient-centered medical home, uses these quality measures, and there's also considerable overlap with access to health care in these quality measures. So, to summarize, physician revenue is based on quality and quantity. Quality is becoming an increasingly important part of this equation, and we expect that to grow in the future. Learning how to deliver quality health care as measured by the people who are monitoring it is really important in demonstrating your value to your local healthcare system and the quality of the care that you provide.